Hi, this is Dr. Robert Chao reporting live from ACR 2021 for Room Now. I'd like to share with you a really interesting abstract on psoriatic arthritis, actually focusing on the treatment of anemia. And this was abstract 1331, which was a post hoc analysis of Guselkumab, which is an IL-23 inhibitor on the treatment of anemia in two pooled phase 3 studies for the treatment of psoriatic arthritis. In this study, over 1,000 patients were analyzed, and they found that at baseline, patients with anemia had worse disease activity with more swollen and tender joints, higher CRP, and increased fatigue than patients without. The Guselkumab treatment groups showed an increase in hemoglobin levels for men and women, especially those anemic at baseline. However, they noticed no change in placebo group. And they did see that after the placebo group switched to Guselkumab treatment, there was an increase in hemoglobin levels. They also noted that anemia resolution was more likely in men and patients with a lower CRP at baseline. And overall, they found that anemia improvement was associated with improved clinical status compared to patients with persistent anemia. And I think we all know that our chronic conditions can be associated with anemia of chronic inflammation. But it's very interesting to see the real life data, especially the baseline data that showed patients who were anemic with psoriatic arthritis had increased fatigue. And fatigue is obviously one of those very difficult to treat measures for us. And I think it just shines light that as we're treating our patients, especially with psoriatic arthritis, we're not just treating the arthritis itself, but the patient as a whole. And perhaps the correct choice in treatment will lead to not just better and improved arthritis, but overall well-being and improvement, and especially in fatigue for our patients. So thanks for tuning in. For live coverage of ACR 2021, please visit roomnow.com and follow me on Twitter at Dr. RBC. Thanks.